May is Stroke Awareness Month. This is an area of medicine where almost everything has changed in just a few short years.
Used to be if you had a stroke, the damage was basically done. That's not always true anymore. Here's Seth Kaplan.
Most of our calls, we don't try to force ourselves off the scene.
Paramedic Josh Erdman and advanced EMT Lacey McGuire.
A lot of things we can handle on scene on our own and administer treatments and make the patient better before we get them over to the hospital.
So strokes are different.
Strokes are different.
Yes.
You have to get to the hospital quickly.
When did everything start? When was the patient's last known normal?
Which means calling for help quickly, not waiting days or even hours after symptoms start.
In the back of our minds, we're like, oh, I wish they would have recognized this sooner.
Either way, quickly on their way to the hospital.
When we show up, we have a physician, a nurse, and usually a CT machine that's open. So we will go right into the CT scanner.
Literally get them off the stretcher, put them on the table, scan them as quickly as possible.
Dr. Steve Zanders, a rare look for us at UPMC Harrisburg's actual CT scanner.
So these are degrees of angles of what we're looking at.
And the artificial intelligence behind it that's changing everything. He might not be in here when the patient is rushed in, but that doesn't matter.
I can actually see this on my watch and my phone, and then I scroll through.
Hoping to remove the clot with a procedure called a thrombectomy.
We're going through an artery in the leg and working our way up through the aorta, all the way up through the abdominal organs past the heart.
And you're doing that with what?
With a catheter.
Now, another rare look.
We have to use this whole table to feed the catheter into the system. And then when we're done, we can re-image the brain to make sure we've accomplished the flow that we need.
Not something that exists everywhere.
Our choppers are on standby, waiting for the go, no-go notification.
To come here or go somewhere else.
And even though we make the diagnosis, we could say, you know what, you're closer to Maryland based on where you are. Let's get you there. That's what we care about.
Again, though, it all starts with knowing the symptoms. Remember, be fast.
The B stands for balance or behavioral changes. E stands for eye. Are they having visual changes or visual loss? F is, do they have a facial droop? A stands for arm. Do they have arm movement? Is their arm paralyzed? The S stands for speech. And then the T stands for time.
That's a big thing that we're taught in EMT and paramedic school, is that time is brain.
And the brain, unlike even other key organs, cannot be replaced. In Harrisburg, Seth Kaplan, ABC 27 News.